Some parents in Colorado are voicing their frustrations and their confusion over the CDC's new childhood vaccine recommendations. State health leaders are saying vaccine guidance has not changed in Colorado, but for a lot of parents, they're just caught in a lot of confusion over this.
Yeah, absolutely. And our Denver 7 Sophia Villalba is joining us live from the State Health Department this morning on what exactly you need to know. Good morning, Sophia.
Good morning. Yeah, state health officials here say that at the moment they aren't changing any recommendations, but let's break it all down for you. So the CDC is now recommending 11 vaccines for children, down from 17 previously. Now, the Department of Health and Human Services says the change follows a directive from President Trump to review vaccine practices in other developed countries. According to the CDC, in 2024, the U.S. recommended more childhood vaccine doses than any other peer nation, and countries without vaccine mandates reported immunization rates just as high as the U.S. One parent I spoke with who has 2 young children says the federal changes are creating confusion, especially when it comes to what this could mean for their community.
I think a lot of the concern right now, because the guidance is unclear, or at least appears to be somewhat unclear, is whether or not things will continue to be made available, whether or not underserved communities will be able to get access to vaccines or the information regarding vaccines, or if their doctors will even talk to parents about potentially vaccinating their children.
I reached out to the Department of Health and Human Services about Derek's concerns, and the agency says it will work with state physicians groups to educate both parents and providers on the updates. Now, state health officials say vaccine requirements for schools and childcare in Colorado are not changing. Those rules are set by the state's Department of Public Health and Environment, not the federal government. I also spoke with a CU Denver professor about what parents should do if they're confused about vaccines for their children, and she said simply talk to your own trusted doctor.
I think families should continue to ask good questions if they have questions about why is a vaccine given, why is it given at this age, what's the importance of it. Some vaccines are really powerful for protecting the individual who gets it, and some are more important for protecting the community.
And Children's Hospital Colorado says it will continue to follow the American Academy of Pediatrics vaccine schedule, something they followed for years. Live in Denver, Sophia Villalba, Denver 7.
Thanks so much, Sophia.